Good afternoon. Thank you for joining us. Good afternoon to everybody on the East Coast watching us. And good morning for our friends. Yes, I see you, San Jose. So thanks for joining us from around the country, and obviously for those of you watching this on demand. I'm Paul Fahey. I'm Vice President with Smith & Jones. Joining me is my friend and colleague, Richard Skiermont, our Creative Director. So I'll introduce him in a little bit more in just a moment. So why don't we get started? It's Dave's cue. So thanks for joining us for Healthcare Advertising Beyond the Cliche Physician Photos. For those of you that are familiar with our series, this is an ongoing monthly webinar series that we produce, not necessarily on this topic specifically, but it builds on a lot of our expertise, and it's part of our mission to give back and share, knowledge and best practices with friends, prospects, clients, colleagues, etc. So thank you for joining us. So this is being streamed. Many of you are here in our live room and seeing this not only here in that platform, it's also being streamed live through many of our social media platforms. So we're live now on YouTube and Facebook, and I believe LinkedIn as well. So as much as this will be a bit of a conversation between Richard and myself throughout the session here, please, if you're in the chat on Live Room, please drop some notes in the chat and we'll try to keep an eye on the comments. So if you see me looking away during the course of the webinar, I'm not day trading, but rather looking at the chat and comments that are here. And this is going to be recorded. So for those of you watching this on demand in the future, normally this is where we have a bit of a disclaimer and say that this is being recorded in May of 2022, and the policies and things that we're sharing during this webinar may change over time. But today's topic's a bit lighter than some of our normal topics. We're actually going to have a lot of fun with this today. So not much will change over time, but thank you if you're watching this on demand. So the panelists, many of you know me, I'm Paul Fahey, Vice President. Joining me live in the studio for our two-shot is Richard Skiermont. Richard is our Creative Director and friend and colleague to me for more than a decade. Richard and I have worked on a number of branding initiatives, service lines, recruitment and retention campaigns for a variety of clients, urban, suburban, rural. In particular, he and I worked with an urban hospital in New York City, a really good community hospital, but rebranding them, merging after a bankruptcy, and a real unique opportunity to reposition them, get credit for the good work they're doing, and get past some of that. So in addition to that, Richard's also worked as Chief Creative Officer for health insurance companies. So he brings a really interesting and diverse perspective to a lot of the work that we're doing, and we're glad he's here. So as many of you know, this is part of our ongoing series. We have our annual trends report, which we launched last fall. We also launched the second edition of our Under the Influence book, which is available. And I think Dave will put up an offer on screen. So for those of you watching us live, visit the website that you'll see pop up on your screen in a moment. And you'll have an opportunity to go onto our website and request a free copy for yourself. It's something we are particularly proud of. It speaks about a lot of healthcare marketing best practices at the brand level, at the service line level, and understanding consumers. And all of that is based on work we've been doing for more than a decade, and on the basis of a lot of qualitative and quantitative research, work that we very much pay attention to what's happening at the American Hospital Association and SHISHMED, social listening, Google Trends, a lot of tools that we use that kind of help inform all of our insights. Though today, as I mentioned, be a bit lighter than that. So our agenda, we want to first start off by introducing you to Dr. Stock, and then Richard and I will have a conversation about branding beyond the stock photo, and in particular, that sort of overused, cliche, perhaps not particularly differentiating physician photo itself. So let me introduce you to Dr. Stock. Paging Dr. Stock. Hear that in your hallways. So if you don't know Dr. Stock, he is a very friendly physician, spends a lot of time with his patients. He's got a significant amount of expertise, especially in areas perhaps of orthopedics. And every so often in the middle of an appointment, he finds this urge to put on a tie, the difference between the first and second shot. He's also agile, he's adaptable, and so if his patient makes a wardrobe change right in the middle of their appointment, he's totally unfazed. In fact, he'll take his tie right off. Or he'll put it back on. He really goes with the flow. He's a very versatile physician, and certainly one that you can come to trust. He's comfortable in any environment, and like a lot of physicians, he really lives what he preaches to his patients. You know, he believes in an active and healthy lifestyle. He believes in staying physically fit, taking care of your health, whether that's on the golf course, in the gym, or on the slopes. He's really comfortable in any of those environments. Avid rollerblader, and even in his own gym. But looking at that image on the right, he understands the importance of relaxing and unwinding. You know, he starts his morning off with a good, nutritious breakfast. Sorry, I can't keep a straight face on some of this stuff. And appreciates that mental balance that you need as well. And whether he's in the garden or at the grill, he understands that importance of downtime to really refresh and have a good work-life balance as a physician. Now, to make ends meet, and who can live on a physician's salary anymore? He has a side hustle, actually a couple side hustles. He's a world-renowned chef, and in particular, in response to a lot of the staffing shortages lately, he's grown his personal contracting business. Many of us I know doing remodeling, new home construction, it's really difficult to find a good contractor, and so that's he's your guy. He also understands the importance of staying hydrated throughout that process. But look, above all, he is a well-respected doctor, unless he's a patient, because he's quite often a stock photo patient, maybe as often as he is a stock photo doctor. And so all of that can lead you to a common stock photo condition, something that we call repetitive image syndrome. So Richard, let's talk about that a little bit more in the studio here. So
Sure.
Thanks for joining us and staying with us through that sort of edutainment, entertaining preamble and bringing us to that. So really, what are we talking about here? It's branding and going beyond the stock photo. Are we saying that stock photos are inherently evil and should never be used?
No, not at all. I think stock photos have a place, certainly in a lot of brands, including healthcare brands. And I know we'll probably talk a little bit about where that's appropriate and where it's not appropriate.
So let's talk about that. Let's talk about that. Where is it appropriate and where is it not appropriate? I mean, when can you or should you, or when should you avoid it? What's the downside to those overly clinical shots?
Well, I don't think I wouldn't advocate any client use them for clinical. I think clinical has to be authentic when you're communicating clinical on your brand. I think you need to use real doctors and real facilities and real circumstances if you're going down that path. That begs the other question: is the clinical, where does that live in the stream of your brand, and are you leading with it or are you not leading with it? So
right. So we're starting this conversation really at the image level, at the tactical level. Right. Where does that conversation begin? How do you then start to decide what is the right manifestation, the visual manifestation of your brand?
Well, it goes back to your brand, and your brand's going to drive who you are and who you want to be to your community and how you want to position yourself, right? So your brand essence is where everything starts. Your values, your tenets, all of those things are going to articulate who you are, what your personality is, how you want the consumer to perceive you, and how you're going to promote all the modalities that you offer. I think the thing that I see mostly when it comes to imagery in general, and stock definitely being one of them, is that there's an inherent push with most healthcare based organizations to lead with technology and lead with physicians. And I think that should be flipped. And I think we have a couple of clients who've done that and done it successfully. And I think that's where it can go off the rails really fast and harm a brand actually than enhance the brand. I.e., if everybody's leading with technology, I'm kind of cold. You're trying to educate me on something that I'm not even prepared to take in yet. It doesn't mean it doesn't have a place in the communication or the stream of education that you have within your brand. But the reality is, what I really care about is feeling safe, secure. I feel like there's got to be authenticity. Want to feel a sense of the community, even if I live in a larger community or a smaller community. It doesn't matter. And I want to know that that I have an affinity for going to this place and feeling secure as I walk through the door. Beyond that, then you have the education part. And it really is circumstantial. Like, I need that now. I need a knee surgery. And all of a sudden now I really care about the technology, the physician, the team, the organization.
Right. So at the brand level, and we've heard this a lot, I think, in our focus groups and research we've done for clients, those key drivers for patients aren't necessarily the latest technology or the best doctors. In fact, they value a deeper team than just, the hotshot physicians. And I think I can see some downsides to that also. If I lead with technology, I'm only as good as the latest technology. So when my competitor gets the latest robot or whatever it could be, now I'm not, and that erodes my brand. I don't have control over my brand. I suppose the same is true even with physicians. If a physician moves on or, over time, we've had clients that have had, issues, there's some misadventures. And so if you're building your brand around those individuals and they move on or have issues, that will erode your brand. So what I think I'm hearing you say is at the brand level, there's a different set of messages, consumer drivers, patient drivers for quality and differentiators. But at the sort of retail level, at the service line or service level, that might be a different mix.
Correct. I think there's a place for, at the brand level, you want to bring awareness to the organization, who they are, what they represent, what they can be to them. Give them a sense of the outcome, right? So when we talk about the imagery that should be represented is, am I going to be healthier? Do I get to live the lifestyle I have? Things like that. At the more transactional or the retail level, that's the area where you want the awareness of that technology, the physicians, the care that they provide, and the credibility that they have. But those two things have to work in a almost an integrated parallel level, right? And then it's where do you place those communications? Where is that consumer ready for that communication? Where is that in that life, that journey as you're getting to know the brand and you're embracing the brand? When do I give you that information? When do I start to educate you about that?
Right. So what I think I'm hearing is at the brand level, and this may not be a universal truth, but at the brand level is where you're more emotive. You want that warmth, you want that sense of caring and compassion. You want to speak to those key drivers, but, and that's maybe a broader sense of communication. That's more mass communication, more mass reach. You want to raise awareness for it. But when I get to more, pardon the pun, surgical. They get to more surgical media buys, or even trying to reach demographics with service lines. That's when I can get a little bit more cerebral. So brand may be more for the heart. The service lines may be more for the head. And that's where I can talk about years of experience, technology, et cetera.
Absolutely.
So talk to me about that at the brand level. Let's stay there for a second. If you were to start building out that palette, what are those types of images? What would that, if you're investing in your own library, what would you want to start to see? What are the kind of things that you would, recommend that the clients develop?
You're going to want to see images of people in lifestyle, basically lifestyle images, right? But
those
benefit-based lifestyle images. It's people out being active. It's people with their families. It's community-based stuff to show that there's a healthy community out there, and I'm part of that. And that in order to stay healthy, they provide a service that if I have a problem, or if my child has a problem, or if my mother has a problem, I know that I can trust them to take care of that problem, and they could then go back to that. So that's how I look at the imagery at that level.
And how do you make that authentic? Because you could buy a stock photo of somebody rollerblading. We saw Dr.
Yeah,
Stock
yeah.
rollerblading.
Yeah.
So, how do you create that context?
You would need to build a library. You need to shoot your own photography. And I know that's an undertaking for a lot of organizations, especially in the smaller rural areas. But it can be done, and it just has to be thoughtful. And when you take your own photography, you have the option of having a lot of different assets and resources then of those images to work with. And that gives you a little bit of flexibility as to where you're applying them to different types of media and different and different channels that you might be advertising the organization through. But I think that's part of it. I think, one of the other things that we talked about earlier ourselves was about, the brand itself, right? So the visual language of the brand may not be reliant 100% on photography either. It could be reliant on graphic language. It could be reliant upon illustration and graphic language combinations. There's organizations that stay away from photography for the reason that we're talking about now, where it can get stale. Even if you're taking your own photography, it can get stale. You have to keep keeping it fresh and moving forward.
Sure. And if you don't, then you've got the Michael Douglas Wall Street cell phones from 30 years ago.
Exactly.
So you've got to keep reinvesting in it. So yeah, interesting. If I can and should build a library that puts my brand in the context of the region that I, serve, then I can do those benefit-driven images. I can show people getting back to a healthier lifestyle and do that in recognizable landmarks or, things that people would say, oh, that's clearly, from here, as opposed to something that's more perhaps generic or that your, competition could even use.
Right.
Those images.
Correct. Yeah. I mean, using the example you brought up earlier about the facility down in Brooklyn, right? The whole push on that was to get in the community, show the community. So, the package we put together to promote that idea, to bring them forward, was to actually go and shoot the community and put them out there. And it was very successful because it was so authentic. This is who we are. This is where we live, and we live in your community and we serve your community. And that authenticity, is what brand should be about.
Yeah, and I think remembering the production aspects of it, and this may be relevant for our viewers. I remember at the time getting our client very comfortable with this notion that, yes, we have a shot list and we know what we're going to be looking for, and we're going to drop a few models and folks in there, but we're going to be pretty agile. We're going to be keeping our eyes open and our pack of releases ready to go. If we see something happening at that street corner or something that was happening over here on the subway, shoot it, get permission for it, and move on. And I think it was that more spontaneous, almost photojournalistic run and gun, that I think led to what you were just describing, that authenticity, but also it wasn't as expensive. I think in hindsight, we were like, wow, I wonder if we could have gotten away with doing that whole thing run and gun as opposed to all that, casting and extras and wardrobe.
Yep.
And all of a sudden we realized this could actually be, far less expensive for us to produce. Again, rather than, relying on those sort of cliche, smiling physician photos, getting back to our headline.
Right. Or pulling stock video. I mean, stock video is a whole nother aspect of it. We could have done that too. We could have developed something that used stock footage instead of going and shooting in general. I think the choice always should be leaning towards developing your own. Shooting, real people in your community is your best effort. I think that's where I would always be leaning, if in terms of photography, in terms of that imagery that you want to have in your library.
And so I think one of the things that you were alluding to earlier is that sense of distinction or differentiation. And our little fun preamble here, with Dr. Stock kind of points out that you don't always own those images necessarily, as you're developing those. And so you wouldn't have the control necessarily to prevent somebody across town from using it or getting confused by it or whatever else it could be. So what are other ways that you could differentiate? How do you make it your own? How do you make it real? You were starting to describe maybe iconography or backgrounds, illustrations.
Yeah, I think when you're developing a brand, you don't want to rely, regardless of the industry that you're talking about, you definitely don't want to be fully reliant on any one direction. Like, you don't want to be totally photo driven. The visual language of a brand should be articulating a fair amount of different things. Photos will always probably have a place especially in the healthcare industry. You're always going to have some photography that you're going to have to use. You need it. I mean, there's going to be a place for clinical photography where you need it from an educational standpoint. So you're definitely going to be in that space. But that doesn't mean that the brand relies on that, right? So distinction's everything. So if I have 3 hospitals in my region and they're all touting the same thing and they all look the same except for a logo and a color,
mm-hmm.
I've got a Me Too scenario. I do the same thing as the next guy does, as the next guy does, as the next guy does. So when you're going into branding, well, the first thing you're looking for is not only who the core brand is, but then how do I communicate that core brand in an authentic fashion that gives distinction, right? So that's the things we focus on when we're building out the brand, and that will inform exactly what we want to do in terms of assets and photos and illustrations and graphics and things like that.
Right, because I think, to your point, if they were all doing those same clinical shots, even some of the ones that we were goofing on earlier with Dr. Stock, that patient caregiver, setting, I think if you mentioned to anybody in the public and said, when you think of a healthcare provider, a hospital, et cetera, what does that look like? It's white lab coat. It's I'm sitting across from a doctor. I want to see him or her smiling, et cetera. And so you're right that, the consumer already knows that. They already, you're not selling them on, well, this is what the product looks like. These are the, by the way, we have an operating room and it's pretty bright and clean.
Right.
And our physicians wear white lab coats.
That can be scary to a consumer. Like, how many people want to be in the facility?
Right, exactly.
So you don't want to project that as your lead because, okay, I know what it looks like. 2, I don't want to be there.
Right, exactly. With the exception of labor and delivery, for the most part, I don't want to be there.
Yeah.
These are not wonderful, magical moments in my life. Now, I'm happy about the outcome. I'm thrilled at how you got me back to that, and I very much appreciate the work that was done, as a patient to get me better. But you're right. People are off balance. They're scared. They don't know how to navigate the process, and it is tempting to want to have that smiling, reassuring, faces or whatever. Right. But the benefit, promise that you were describing earlier sounds like it would trump, many of those things. So now, again, we're not saying that you should never use physician photos.
Not at all.
When would it be appropriate? When, could you see that being something or some of those contexts when it's very much maybe even essential to do that?
I think there's multiple times where that can be that it gets applied. One is the channels that you're choosing, right? I think that announcements of new physicians and new staff that are important to the brand can be announced in video format, that could be put on the website, that could be announced in social settings, right? So Facebook. If you're looking in the business community, it could be LinkedIn, things like that. So I think there's those areas. I also think, that, when you have maybe a small rural scenario, a hospital or organization that hires somebody big coming into the area, I could see a micro campaign going out where you're making an announcement. Hopefully they won't have a problem a year from then, but to your point earlier, but that's a big thing, right? So you can make that announcement. I wouldn't dwell on it. I wouldn't put a big campaign against it, but I definitely would announce it. It's not going to be on the billboard, but it might be an announcement in some sort of a more mass, appealed medium.
And I like that approach. I've seen clients before say, we're really excited that we have this caliber, this level of experience, somebody coming into our community. He or she could have gone anywhere, but chose to come here for the same reasons that we all live here. There's lifestyle or quality of life, whatever it could be. So I like the idea that could even help elevate perceptions of quality or whatever. Mm-hmm. But your point is, don't do that at the brand level. That's not a billboard. That's not a TV commercial, but that's probably great for what? Social media?
Yeah, social media, video.
Like a video on your website, that kind of thing.
Yeah, exactly. Mm-hmm. Yeah. That's where I would see that being applied. And we've experienced that, where the announcement becomes bigger than the brand. Mm-hmm. And that can be detrimental. You're building somebody's brand. You're not building your own brand at that point. So
right, and it should, and I believe actually most patients don't always have as much exposure to the physician as they would the rest of the supporting team, the folks that are there from admissions and the nurses.
Correct.
When we talk to them about, what shaped your experience, when you said, that you appreciated everything, that you were happy with this, that you trust this brand, what is that based on? Yes, it's that 5 or 10 minutes of interaction between the physician, but the nursing staff, the administrative staff spend hours and hours with me as I was admitted. And those folks very much shape, I think, the brand experience.
Right, because at the end of the day, it's the total care that you get in those settings, and it isn't always hinged directly on that physician. A physician is going to do a job that's important. And it's going to give you an outcome. It's the whole experience around that physician is not around for that makes all the difference in the world.
So there's some fragility building your brand around technology as much as it would be a physician. There are things that could break, something got newer, something moved, somebody moved, whatever it could be or whatever. So now there's some pros and cons to stock photography. I mean, if I get a call at noon today and a client needs something to go out the door by 5, I don't have time to cast and, shoot and do all those kind of things. So it's got some agility. What about the cost considerations, or is there any way that I can control stock photography, or when do I, how do I compare that to custom?
Well, yeah, you can certainly, everybody thinks about stock photography as being a royalty-free scenario. So you've got your subscription, you get, 25 images a month, and it's costing you $9 a month. Yeah.
Right.
So those are the photos you want to stay away from. So you want a rights-based or a rights-managed stock if you're going to go down that path. The cost of those can be anywhere. It could be on the low side of $750, and it could be on the high side of several thousand.
$750, not $7.
Correct.
So,
and that would beg the question of when do you hit that moment? And granted, if you had a need and you needed to get it out by 5, great, you go and do it, right? But in most cases, that would be a really special need, right? So let's say where would we use that kind of clinical-based photography, right? Clinical-based photography is going to be used in your collateral. It's going to be when you're educating, when you're handing something over to somebody when they have a need, right? You go to your physician and he says, "You're going to send you to the specialist. Here's who the specialist is. This is what they do." You want that information then. You don't need a happy, smiling face of somebody, playing in a yard. It doesn't connect. At that point, you're looking for that deep dive into what are you giving me, who is giving it to me, and how am I going to feel afterwards. So those images are really important at that point. So that's something that we definitely would be allocating to be sourced or shot, right? So the question is, if you're using those kind of photos, and you can source those out and do a rights managed, but when does it end up having the opposite effect? Like you're killing your budget because you're buying one-off images at $1,500, $2,000. So when you make the decision of, I'm just going to build a library and hire a photographer where I'll have more options, I can control the setting. It's authentic. It's my setting, and I can control what I have at the end of the day. And I think that will come on you very fast when you're doing the one-off.
Right. So the royalty-free images, the ones we think of, the ones of our friend Dr. Stock, those are royalty-free. They can cost, a few dollars based on your subscription, or $50, maybe $150 at the most.
Right.
Tempting to use. Yep. But you're never going to want to do that at the brand level, and you probably won't have any brand level emergencies. I need to get that billboard out. I need to start producing that bigger campaign. So the need for that may not be there. At the service line level, at that education level, you may have information sessions coming up that nobody told me about. I got to get you something. We need some handouts. That's, I think, where you could see it. But to your point, those stock or the royalty-free, rights managed could cost $750 to $1,500, $3,000. But let's say, all right, on average, $1,500. If I have to do that a few times a year, I'm paying for one image.
Right.
So, when I look at my year as a whole, and you've heard us say this before, in our marketing plan sessions, all good marketing directors are like chess players thinking several moves ahead. Doesn't mean that you're not going to have something come at you that you weren't expecting that you have to respond to. But looking at your yearly budget, and then making a commitment to, all right, so now if I've done a photo shoot, my images are less generic. I can shoot them in the town square or,
Yep.
some other setting that's, very recognizable and clearly speaks to the region.
Mhm.
And, the yield. I mean, you could get hundreds of, alternate angles with and without the models,
Yep.
verticals, horizontals, all those things that you might need because the stock would be very limiting. It's like, well, they only have that and at that. And if I want to put my headline here, I'm kind of limited. So it sounds like there could be room for stock in all places.
Yeah. I'm not where this isn't. I don't think we're advocating for anti-stock. It's just where do you use it? How do you access it? And be deliberate about how you're using it and why you're accessing it.
Yeah. And Getty, if you're watching, we love you. And Adobe stock, you guys are fabulous. Shutterstock, love you guys. Right. Don't shut us down. Right. They're not gonna shut us down.
No.
All right. Good. So I'm kind of coming to the end of my questions. And certainly as we think back to the headline, I think, just sharing, a few moments of infotainment with our audience, helping them navigate, building a brand, the visual aspects of the brand. Any parting words of wisdom or bits of advice?
I think the only advice I have is if you're rethinking your brand or you're reestablishing your brand, and I'm saying that because how many times do you see a new hospital come up, right?
Right.
It's usually it's a rebrand scenario, or you're looking to refresh your brand and looking into how do I refresh it. Start there. Don't start with what imagery do I need, because the imagery will follow, and focus on where you want to be, how you want to be perceived by your consumer, and work from that, because it will inform some of those decisions. As far as the tactical part of that and making those choices, I think clearly what we're talking about here is stay away from anything that's generic stock. Use it appropriately. If you're using stock, know where it makes the most sense. I think the bigger story here for me is not leading with, the technology and the clinical feel, cold feel for any brand. I don't care who it is. I think that's always negative, even though it informs. So I'm not saying it doesn't have a place at the table and it doesn't inform the consumer, but at the end of the day, if that's all I know about you, I'm not getting a warm and fuzzy, and I don't know that I'm going to become a brand ambassador and want to go only to your hospital if I have three choices in the community.
That's great. Fabulous final word. Richard, thanks for joining us on this month's. I know you love doing these things.
Yeah,
you were really excited when we asked you to sit in on this. And thank you all for watching. For those of you that are live, I saw some folks clicking in on the offer on our live platform for the book. Join us on the website. Would love to share a copy of Under the Influence, our healthcare marketing best practices with you. We're going to be back live again mid-June. I don't believe we have a date or topic secured yet, but I'm sure Rich will be just thrilled to join. You're not going to be.
No. He's like, it's not going to happen again.
But thanks. I mean, we hope this has been, helpful, informative, help you navigate not only the, branding for your organization, but the visual aspects of it, and do that in a way that is, as Richard said, distinctive, memorable, emotive at the brand level, cerebral at the service line level, oversimplifying, but I think keeping some of those things in mind. So thanks again for joining us, and enjoy the rest of your day.